So teeth grinding and clenching are massively undiagnosed and untreated conditions. They're very common, affecting 80% of the population at some stage in their lives. Hi, I'm Dr. Sarah Hughes. I'm a dentist with a focus on treating bruxism. So teeth grinding and clenching are massively undiagnosed and untreated conditions. They're very common, affecting 80% of the population at some stage in their lives. Most people aren't aware of it, and it may be pointed out by their dentist at a routine dental checkup or by their bed partner who's been woken up by strange noises in the night. Bruxism is the medical term for teeth grinding and clenching. It's repetitive involuntary muscle activity, characterized by teeth clenching, grinding, bracing or thrusting, with or without tooth contact. It happens in adults and children. Bruxism symptoms include the clenching or grinding habit, difficulty opening and closing your mouth, jaw pain, tooth sensitivity, and may affect your sleep or cause sleep apnea. More serious complications can be clicking or popping jaw joint, damage to your teeth, cracked teeth, broken teeth, damaged dental work, and can lead to temporomandibular disorders. Can also lead to headaches, earaches, and jaw, neck and shoulder pain. What are the causes of bruxism? The main causes are stress and anxiety. Other risk factors include joint hypermobility, some medications, sleep disorders such as sleep apnea, drinking alcohol, smoking, and a high caffeine consumption. What types of bruxism are there? There's either sleep bruxism, which happens at night time and is mostly grinding, and there's awake bruxism, which happens during the day and is usually clenching. We either have one or the other, seldom both. Can bruxism be prevented? There is no cure for bruxism, but it can be managed. So modern conservative management involves education, self-care, and using some non-invasive reversible treatments. So how much does bruxism treatment cost? The initial assessment is $120. That involves a full assessment and you'll be provided with a self-care plan. Other treatments are occlusal devices or Botox injections. What treatments are available? There are many treatments available for bruxism. These include stress and anxiety management, physiotherapy exercises, thermal therapies, and occlusal splints and Botox injections. We will recommend a suitable bite appliance for you. It could be a soft splint, a hard splint, or a sleep clench inhibitor. These help to relax the involuntary muscle activity movements and prevent symptoms. And they also protect your teeth from tooth wear. Botulinum toxin is injected into targeted muscles. It prevents the release of acetylcholine at the neuromuscular junction, and this prevents the involuntary muscle activity. It allows the over bulky muscles to atrophy or to debulk. Be reassured that voluntary muscle activity such as chewing, talking, and your facial expressions will not be affected by this treatment. I call it the muscle melt. The treatment procedure. So at your initial consultation, we will take a full history of your complaint and identify risk factors. You will have a full muscle assessment and we will record the range of movement. We will check inside your mouth for signs of bruxism, such as tooth wear, broken teeth, broken dental work, for any signs on the sides of your tongue and the insides of your cheeks. We may take some clinical photography or scan of your teeth for monitoring purposes. Aftercare. Your supported self-management care plan will explain your diagnosis and provide you with resources and tips on self-management. Important aftercare includes daily stress reduction, relaxation, reducing caffeine, alcohol intake, and stop smoking, and to avoid hard foods. For botulinum toxin, there is no downtime. You can go straight back to your normal activities. You just need to make sure you stay upright after your treatment, avoid rubbing or massaging the area for some hours afterwards, and avoid hot activities such as hot yoga, saunas, and steam rooms. This is to prevent the injected fluid from spreading to other muscles. So what are the benefits of bruxism treatment? Benefits are to prevent the symptoms and to prevent further complications. Although bruxism is a common and benign condition, if left untreated, it can cause serious damage to your teeth and to your chewing function. And many symptoms are unlikely to be dentally related, so may go untreated for many years. Often with patients showing up at either their GP or a plethora of different health providers seeking relief for chronic pain, which actually has origins in bruxism. Severe bruxism can cause significant damage and pain. So you can get jaw pain, you can get prolonged migraines, tinnitus, chronic neck and shoulder pain, and it can lead to temporomandibular joint disorders.